So now that we're preloading, we're going to be in the Sim Lobby Hospital. So as you can see, I am in the hospital and it's downloading some assets for the software. At this point, what you're going to do is you see this big box in the middle of your screen, all right? So you're going to, once the moderator starts the case, you should be able to click on Search Sim Groups right here, and you're going to use your B button, okay? Your select button. And you're going to see the CEC WSOM group code right here, okay? And you're going to select that, all right? So it's going to join the simulation. It's going to download all the assets for the case. And now we're going to get into the hospital room, and I'm going to do a very quick orientation of how to triage your patient. So we are now in our patient's room, and I'm going to orient you to the room and the different things that you can do in the room and how you will do that with your controllers, okay? So the first thing I want you to do when you go into the room is put your hands in front of your face, fist bump. So when you pick up anything in the room, you're going to use your trigger finger right here. This is your trigger finger. You can see that it opens and closes my hand, right? So I'm going to fist bump. I'm going to keep my trigger fingers held down, and I can fist bump, okay? So this is how you pick up things, right? And so then I'm going to go through the other functionality of the room. So we have our patient here in the bed. The patient can talk to you. Everything that you need is in this room right here, okay? So the first thing you're going to do, we have a nurse in this particular case, all right? So she's in the room, is you're going to wash your hands. You're going to scrub up, right? So we're going to go over, we're going to wash our hands, right? Again, I'm just holding my trigger finger down, okay? And I'm going to put it in the trash. So now you're going to want to put your gloves on. Your gloves are on your wall, so you're going to walk over. You're going to grab a glove. Again, you're going to use your trigger finger, and you're going to put it on one hand, grab it with the other, put it on the other. So you've got your gloves on, okay? All right, so we're using our trigger finger, okay? Let's cover this patient back up. So to grab, I'm going to put her robe back on. So I'm holding my trigger finger down. Okay, I'm going to put her gown back on, and she's cold, so we're going to cover her back up with the blanket. All right, and to let go, you just let go of your trigger finger, okay? So we have our patient in the room. You can lock the bed. So if you look down here, you can see that I can lock it or let it go and take the brake off. Again, what I'm doing is I'm just holding my trigger finger down, okay? So I'm going to go ahead and keep it on lock, right? Over here, we have our up and down where we can raise the bed up or we can put it down, okay? So I'm gonna go ahead and move it down a little bit. Again, you're holding your trigger finger, okay? All right, so we have back here, you see your blood pressure cuff, your monitor leads, oxygen. You have a pulse ox in here. This is where your oxygen tank is. So when you go to hook up your oxygen, you will actually hook that up and turn it on, and I will demonstrate that in just a second. We have a phone. So anytime in a case, there could be an attending provider available. If you need some additional help, you can pick up the phone and call for help, okay? All right. Also on here, we have an EHR. So I'm going to pick up the EHR by closing my trigger finger. And now I can see that I can do a patient overview. Now, to select anything on the EHR, if you just hover, you don't have to hit your trigger finger or hit a button. If you just hover over it, you can see here where we'll pull up some information about this patient. You can see her patient overview, medical history. To go back, this arrow right here, you can go back. Okay, if I want to see if there were any active orders on this patient, again, I'm going to hover over it, and you can see here she has some active orders, and there's multiple screens to this. So if you just hover over the screen and swipe, you can get to the first and second, third screens, okay? I'm going to go back again. All right, so you may have a case where you may have to do the ordering. You may have to order medications, you may have to order labs, EKGs, x-rays, and so you will use the EHR to do that. Again, if you go to laboratory and diagnostic results, if something has already been resulted on your patient, you can go there and look at the different lab results or other procedures that they had done, okay? So very easy. Again, I'm just hovering over that screen. I don't have to hit my trigger finger or button, and I'm gonna go back, right? So that is your EHR, okay? So I'm gonna go ahead and just put this down, right? Okay, So you can talk to your patient regular. You see that she's a fall risk patient right here. We can double check her armband. She's already got an IV in here. So what we're going to do is we're going to go ahead and take her blanket off. Again, I'm using my trigger finger and I'm just going to throw it over there. And is it okay if I remove your gown? So they're going to say yes, so we're going to remove her gown, okay? Now, over here are your cabinets. So you have medical supply cabinet and you have a linen cabinet, right? And you can open up any of these drawers. To open up or close, you're holding your trigger finger down. In this top drawer, you can see that you have a normal saline flush syringe, you have some alcohol swabs, you have a thermometer where you can take her temperature, and you have a light pen, right? So if you want to do an eye exam on this patient or a throat exam, if you come over and look at the patient, she will look at you and you can look inside her throat, okay? Again, you're just holding that trigger finger down, okay, to perform that exam. Perfect. All right. If you want to take her temperature, come here. You can see here that she has a 36.9 Celsius temperature. All right. So I'm going to put that back down. I'm going to shut this drawer. And then down here, you have your IV fluid. So if you wanted to hook her up to an IV, you can grab a bag and you can come over here and hook it up. Now, if you are starting IVs, you actually have to hover over and click start. Again, you don't have to click on a button. If you just hover over it, it'll start. And this is where you have to determine how much to give, okay? If you want to stop an IV, you just hover over the stop button and it'll stop it. And you see here where it says stop, okay? All right, so I'm gonna shut this drawer here. These are your linen drawers. You have some gowns, some extra sheets in here, and some pillows, okay? Over here, you have your order entry for your medications. So if you wanted to order a medication, let's say you wanted to order some insulin, you hover over that. The insulin will appear on the table. So this is the tricky part. You're going to grab the insulin, the medicine, with your trigger finger, and you can see here that I'm holding that insulin in my hand, okay? Now you're going to grab the syringe, okay? And you're going to insert it into your valve right here, okay? Now you're going to use your wheel, okay? So this is what I'm talking about. This wheel right here, this little black rubber thing is your wheel. And this is what we will use to do the medication, either to fill your syringe up and also to give it. So when you are inserting the medicine, you're going to pull down on your wheel like that. And then when you give it, you're going to push up on your wheel. Let me demonstrate that. All right, so I'm going to grab the medicine and I'm going to stick it in here and I'm going to pull down. I want to give her 0.50 milliliters and I'm going to hold that trigger finger down, okay? I'm going to walk over, okay? And I'm going to inject it and I'm going to push that wheel forward, okay? Now you may inject it subcutaneously or you may inject it into her IV depending on what medication you're giving her, okay? So that's how you do the medications, is you have to utilize your wheels on your controllers. So we're gonna go ahead and get her hooked up to the monitor. I'm gonna get her blood pressure cuff on. Again, I'm using my trigger finger. I'm gonna put it on her arm. We have our monitor leads. I'm gonna just drop it on her. So now we have her monitor on. You can see her vitals up here on the monitor. Okay, I'm going to show you how to do your oxygen. So if you want to put her on oxygen, you're going to grab it. You're going to put it on her. And here you see the tube. Okay, you see the tube. You're going to grab that tube with your trigger finger and you're going to put it on the oxygen and you're going to turn it on. Right? Perfect. Okay, maybe that's a little too high. There we go. Okay, so that is how you do her to start her monitor. I'm also going to put her pulse ox on, and I see that pulse ox in the tray right here. So you see the pulse ox, I'm going to put it on her finger. Okay, so we want to make sure that we're monitoring all of her vitals. Now, for the patient, you can do heart and lung sounds and you can feel pulses anywhere the patient should have pulses, and I'm going to show you how to do that. So if you hover, you don't have to click on a button. If you hover over her fetal pulses, you can feel that in your controller, okay? You can feel pulses where you need to, okay? All right, so I'm just hovering over the patient. Now I want to listen to the heart and lung sounds and abdominal sounds. So I'm going to grab the stethoscope. My trigger finger, grab the stethoscope. I'm holding that trigger finger down, and I'm going to listen to lungs. Okay. I'm going to listen to heart and abdominal sounds. Okay. Very easy. All right, I'm going to put my stethoscope back down. Okay. In some cases, you may have to intubate your patient. You may have to defibrillate your patient. So depending on your room, when you go into your room, you're going to first define roles. Who is going to be the lead in that encounter? Who's doing the EHR role? Who's doing the physical exam? Who's asking the history questions? And you want to make sure you look at what everything is in your room. You may see a defibrillator in your room, all right? And the way that you do that is the same with IV. So if you go over to your defibrillator, you're just going to hover over the wattage and start or stop it, okay? And so that is basically your orientation to the room. When you have your, your needle bucket over here, so you want to practice good patient safety and precautions, so you want to make sure you put your needles in your bucket. If you get stuck in a case, again, you can pick up the phone and call the operator, all right? So I'm going to cover this patient back up. All right, we're going to put her gown back on and her blanket because she's cold. Okay, so that is your basic orientation to your exam room. Remember, always wash your hands, put your gloves on, start putting your monitor leads on, the patient's blood pressure. If they need oxygen, you can put it on. If they don't, you don't have to put the oxygen on depending on your case. Have fun. This is a great learning experience. Enjoy this technology, and I look forward to working with all of you.